Have you been told you need to stop doing what you love, whether it's exercise, running, or a sport? Well, here at Dynamic, we don't like that answer. In this podcast, we'll talk to leaders in the health and wellness space from Southwest Florida to get the solutions you need to get you back to doing what you love. Welcome to the Dynamic Naples Podcast. What's going on? Dr. Chris here. Today, I want to talk about a pretty specific topic, and that is the link or the correlation between iron and diabetes. And this is kind of near and dear to my heart because I've been dealing with some high iron for a long time, as long as I've known about. And I also have some blood sugar dysregulation issues that I've been trying to address as well. As I assume you know, the body deals in balance. So anytime you have too much or too little something, usually an issue arises. And what's kind of interesting is if you have too much or too little, the symptoms tend to be the same. Not always. And in this case, it can be different in the fact that too much iron can kill you. Iron deficiency anemia is usually pretty easily managed. It definitely affects way more people, so there's a lot more awareness around it. It affects something like 3 million people per year in the United States. That's the iron deficiency anemia. However, iron overload or excess iron affects 200,000 people per year in the U.S., so it's still somewhat common, nowhere near as the same levels as anemia. But too much iron can be deadly because it can literally basically rust your organs. Iron is an oxidizer, so things oxidize with too much iron. It definitely affects men more than women because men accumulate iron over a lifetime, whereas women lose iron from menstruation and childbirth. So that's one thing to be aware of. After menopause, it can become a problem for women, and this is probably why we see an uptick in cardiovascular disease, which I'll get to after menopause. So what can happen is women can be anemic through their menstruating years, been told to eat an iron-rich diet or take iron supplements, and then never told to change that after menopause, and then suddenly they go from anemia to overload. So there's been some mounting evidence that show a link between the development of diabetes from too much iron. We already know that there's a strong association between diabetes and cardiovascular disease. I've written blogs and done some podcasts on that. So go back and read those if you haven't yet. But the theory with heart attack in post-menopausal women is the sort of that estrogen has a protective role, and hormone replacement is kind of the main line against protecting against heart disease. But there's been some questions, and that is somewhat controversial. There has been some research showing that it can actually increase heart attack. Now, from what I've read, the evidence is all over the place on this one. But what I'm suggesting is that iron may be a player in all of this. So in 2002, a study was conducted that aimed to determine if phlebotomy, which is bloodletting or blood donation, affected risk for heart disease. And when iron depletion reaches near deficiency levels, you get a reduced risk and improvements in your lipids. Blood pressure reduces, triglycerides reduce. There is also an increase in response to glucose and insulin, so making you more insulin sensitive, which is what we all want. So these are all metabolic markers, and these can be completely reversed with iron repletion. So as I mentioned, iron is an oxidizer, and one of the things it can do is accumulate in the body, and it affects different organs. So it can affect the pancreas and interfere with insulin synthesis. That's the hormone that regulates blood sugar. And there's evidence that this is a two-way street, meaning that insulin stimulates cellular uptake of iron, creating kind of a vicious cycle. And we have some other clues that iron overload can affect blood sugar in a negative way. Too much iron can deposit into muscles and damage it, which can inhibit the ability for the muscles to take in glucose. So therefore, you have the circulating glucose stays in the blood as opposed to going to those metabolic sinks, aka your muscles. Also, you may have heard the term type 3 diabetes. That is a newer term for dementia due to diabetes. And they have found excess iron deposits in the brains of patients with Alzheimer's. Gout has also been linked to insulin resistance, and blood donation can lead to decreased gouty flare-ups. Now, it's important here to note that iron is the least sensitive marker for iron on a blood work panel. So let me say it again. Iron is the least sensitive marker for iron. I know, it's crazy. Only about 1% of the body's iron is floating in the serum. Ferritin is the body's storage molecule for iron and can be way more reliable in terms of a blood panel and finding out your iron stores. The tricky thing, though, is that the body will lock up iron because basically viruses and bacteria can, just like all life, need iron to replicate. So when the body recognizes there's inflammation, it'll raise your iron stores to basically protect yourself and protect from the organism's replication. So it's a pretty clever mechanism, but you can kind of get a false positive. You'll see maybe if you're inflamed, it'll show a high ferritin number, then you're going to think that you have iron overload. So what you have to do is you have to look at some of your other inflammatory markers and kind of correlate that. Like CRP, for example, is the classic one. If your CRP is elevated, you know you're in an inflamed state, so you'd expect that your ferritin levels will be higher, which, by the way, is a clue with anemia as well. If your inflammation markers are high and your ferritin is normal, well, it's probably storing some iron, so you actually may be anemic in that instance. So another study found ferritin levels have been linked to insulin resistance in even seemingly healthy people. Another study found ferritin was proportional to glucose concentration, blood pressure, and HDL. In epidemiologic studies, so observational research, the higher the ferritin levels, the higher the incidence of type 2 diabetes, and you can predict future diabetes with ferritin levels. So one of the challenges, though, with diagnosing it is, or too much iron that is the symptoms can be very vague because it can attack basically any of the organs. So here are some of the typical ones. And again, these overlap with so many other disease processes. So fatigue, joint pain, impotence, loss of libido, skin bronzing, palpitations, depression, abdominal pain. Now, those I assume would come with much higher, sort of end-stage levels of iron overload. So, what I'm suggesting here is that, maybe blood sugar trending in a negative way may be a sign of iron overload. So how is it that we accumulate iron? So it's either from excess consumption, either from the diet or from supplementation, or we just absorb too much of it. So this is what I've been dealing with, something called hemochromatosis. So hemochromatosis is a genetic defect. It's a SNP, and it causes the body to absorb more iron than it needs. And the thing is that it's getting better now with DNA testing, but it's often misdiagnosed or completely missed, and then the average person will wait 9 years for the correct diagnosis. The mutations C282Y and H63D are most highly associated with hemochromatosis. There's other ones too. If you've had a recent DNA test and you want to find out if you're at risk for hemochromatosis, there's a worksheet I have on my website. I'll put a link in the show notes so you can download that for free. You just have to give me your email address. Besides hemochromatosis, there are some dietary and lifestyle things that can increase iron absorption. So foods that are high in vitamin C and beta-carotenes can increase iron absorption. HDL supplements or digestive enzymes, which can be a good idea in the case of hypochlorhydria, where you don't digest your food as much, but they can increase your absorption of iron. A diet high in red meat and liver can do it too. Sugar increases iron absorption, and so does alcohol. So those can all be strategies if you are anemic, iron deficient anemic, that is. But if your ferritin levels are high, you should probably avoid those diet choices. So what can you do? You can donate blood, and that's what I do. In this state, I can donate every 56 days. So I don't do it every 56 days exactly, but I try to do as much as I can. That's a really reliable way to reduce your iron stores. It also can reduce your blood viscosity or the thickness of the blood, which can be a risk factor for heart attack. And I just know from talking to people that this is just sort of a side benefit. Many people report some weight loss with frequent blood donation. And you'll read online about the calories that it takes to regenerate red blood cells, so you get a thermogenic effect, and there's just the actual volume. So that may be part of the weight loss, but I think it just makes sense that if we know that insulin resistance leads to obesity, so if you're becoming more insulin sensitive over time, it sort of makes sense that you'd be losing some weight as well. So if you suspect you have this, check your blood work, check your DNA, see if you've got hemochromatosis, look at your diet and your lifestyle. But if you are worried and you want to get on a free functional medicine consult, call me. I'll drop a link as well in the show notes. I'll also put all my references for this podcast. I wrote a blog on it too. Get on a call right now. We're doing free consult calls. It's going to be for a limited time only until we fill up at capacity. So take advantage of that while you can. Why guess when you can test? Do you get hangry or crash after a carb-heavy meal? These could be indicators that there is a dysfunction in your blood glucose regulation. If left unchecked, it can lead to irreversible changes. If you catch it quick enough, you can make diet and lifestyle changes that will get your levels where they need to be. 88% of Americans are pre-diabetic and don't know it. Diabetes underpins many of the pathologies we deal with in this country, such as obesity, high blood pressure, heart disease, and stroke. For some reason, it is rarely screened with your physician, and if they do test for blood glucose, it's usually with an A1C or a fasting glucose, which can sometimes give you a false negative. NutriSense is a company that supplies continuous glucose monitors. We've paired with NutriSense to get you real-time data to see how your physiology responds to glucose. The NutriSense app lets you track your daily activity to see how food, sleep, exercise, and stress impact your glucose. You can log or import this data into the NutriSense app to see the effect on your blood glucose levels as soon as it happens. Use the code DrChris25 for $25 off your order today. Do you have unexplained pain? Or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great tool to stay ahead of any health conditions, and now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's thyroid function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It is sent to you with free shipping, and you get your results in 2 to 5 days. No physician referral needed. Use the code DPT25 for 25% off. You can find links in the show notes. Did you know that you can get started with physical therapy without a physician's referral? Physical therapists don't just solve pain, we get down to the root cause and keep it from coming back. We also discuss all things health, such as nutrition and lifestyle changes. If you feel that you could use some help, let's get on a free consult call. Go to www.dynamicnaples.com and sign up for a free call. Also, if you like this podcast, please give us a rating wherever you listen to podcasts. It helps us spread the message. Thanks for listening, and we'll see you next week.